Hi guys, in this class we'll learn about the macronutrients. These are calories, proteins, fats and carbohydrates which are mainly helpful in maintaining the body weight and managing the diabetes mellitus and how it will affect the management of diabetes mellitus whether in a good way or in a negative way. Okay, next we have learned earlier that sufficient calories should be given to maintain an adult weight, ideal weight. See, ideal weight here means there will be normal range for every height and for every height. If you are certain height, then there should be certain weight. Okay, this will be chart and I'll provide the chart in next classes. First one is ideal weight, and now here means if patient is obese, then we have to decrease the calories intake. We have to be through the diet which we prepare for the patient. If patient is undernourished or malnourished, we will again give them the increased calories through the diet, so that can help them to maintain their ideal weight. Okay, and it also helps to provide normal growth and development for the children and adolescents, and also provide for the increased needs during pregnancy, lactation and illness. Okay, first one we'll learn about calories. Calories. See, here calories means the energy requirements of adult patients is governed by their present body weight. As I already said, for every adult patients there would be a certain height, and based on that height and their body weight, present body weight, and we will calculate the ideal body weight, which means we for that height what is the ideal body weight, that means what should be the body weight, certain body weight it should be for the patient. Means if ideal body weight is 35. See, for suppose if the body ideal weight should be around 60 to 65, but the patient is 55, that means he is undernourished. There are some other calculations also, I'll explain in further classes. When that chapter I'll tell, when I teach that chapter I'll tell you about the how what are the calculation and how it should be done. Now here it's saying based on the body weight, ideal body weight and the height, we should know whether the patient is undernourished, normal or obese. Based on that we will calculate the calories, means how much calories should be given and what are the energy requirements of the patients and everything. See here, that's what it's saying. Remember, we learnt about computations of energy requirements on the basis of ideal body weight. As I said, based on the ideal body weight, we'll calculate the entire process. Okay, this gives details of energy requirements for excess and normal underweight patients. We calculate what are the energy requirements. It's also based on the activity that is done by patient. Means based on height and weight we calculate certain calories, that is 3000 calories, but the patient is sedentary, means he should be given 3000. If the patient is athletic, we will again give the patient extra 500 calories, that means 3500 calories, like that, based on the patient environment, his economy. As a previous class, as I said, based on the patient age, height, weight and everything we calculate the diet. So for every patient the diet will be changed. Okay, see, this is the table that's saying, as I now not giving the patient actual diet or how much it's required, so I'll just skip this part. but when I actually prepare a diet and I'll give you a diet chart for everything, then I'll tell how this table is useful and how this table is used to calculate the calories and everything. Okay, after calories, now proteins should be provided in adequate amount to maintain a normal body composition and to prevent depletion of lean tissue mass. Okay, pretty, as you guys already know. I think I don't have to say much about proteins, because as you guys all know, you are drinking protein powders and everything, so it's not that I'll just